Hi, you guys. My name is Leyla, and I have enough courage right now to talk about my jaw surgery. Thanks to all you guys. Where to start? This is I wanted to do this video because you have helped me a lot, so I don't feel like I'm the only one in the world that is doing this. I especially want to thank. I want to thank you all, but I've been watching Valerie's videos a lot, Shabanimals videos, and this cute girl from England with the red hair. I love your accent, by the way. I love to see your results. Um, so I never thought I was gonna do any sort of videos because I thought that I don't want to show anything before my big surgery or after it's done. Thanks to you, I'm doing it, so I'm not a coward anymore. And it will probably be on the internet for as long as we live. I don't know how I feel about that, but it doesn't matter. If it helps somebody, it helps to know that we are many people in the same situation. So a little about me. My name is Leyla. Like I said, I am 25 right now. God, time goes fast. Um, I recently finished my studies in molecular biology, and now I just have my surgery to worry about. Yeah. I also wanted to say that I'm doing the surgery in Sweden, so um, I want to tell you all how it's done here in Sweden, the Swedish way of treating this sort of surgery, and yeah. To begin with, I got my braces in October, November 2010. I had to remove 4 wisdom teeth because they blocked my mouth. And I did so, or they did so. I recovered really fast, no problems, just like 1 day or 2 days. They put in bridges. I don't know if you call it like that in your countries. These small things that they glue to your teeth first, and then I got different kinds of wires, more loose ones in the beginning, and then after 2 months they switched to more stronger ones. One thing that was cool, I thought, was that the wires are they become really, I don't know, strong or unflexible if they're in hot temperatures or warm environments, and if they're in cold environment or if you drink something cold, they will get a little bit looser. So in the beginning, when you're hurting as hell, um, then you just drink something cold, like a, I don't know, cold Coke or something, and then it relaxes your teeth a little bit. Don't do too much then, because then you will not get any results. Yeah, the Swedish way of doing this kind of process is that first you go to a normal dentist, and they tell you the options, what's wrong, what's not, what you can do, and then you apply um, for this kind of treatment. And this is where it takes a lot of time in Sweden. I don't know how it's done in your countries, but here, I don't know, 2 years from the day that I applied to until I got an answer that I could go through all this, and that my insurance company was gonna pay for it. But it was worth the wait, especially if you're like me, thinking about it all the time and have problems with chewing, because now I cannot bite anything off. I only used two four teeth, something like that, to eat with. And also I got a lot of pain in my lower jaw, um, and aesthetically wise, I think I wanted to do this, so that's why I'm doing this. What else? Yeah, like you probably noticed, I have an underbite. I can show you, although I don't want to. You can see here. It's not as big as maybe most of you, but it's there. Uh, Maybe I can show some on the side as well. It looks like this. So you can see. um the thing with me and the surgery before, well, what they said was that they were just gonna move the lower jaw to back. But after they did all kinds of tests and measured my face and all these weird things, and they came to the conclusion that my lower jaw was really okay. It's just that my upper jaw hasn't grown as much as it should. Um, and this, of course, in my case, is a genetic fault. I got it from my nice grandmother, who I love so much, but not for this. um, so I'm gonna, or they gonna, move both my jaws. Um, the upper jaw 3 millimeters to front, and my lower jaw 3 millimeters back. I've put in a list of words what I should say so I don't forget anything. Of course, I will forget something, like always. Yeah, wisdom teeth, check. Yeah, this is the last week before my surgery. Today's Friday, the 30th of March, 2012. I'm having my surgery on the 2nd of April, on Monday. So this week has been hectic. I had a lot of appointments. Um, the staff here, they're really careful and thinking about everything before the surgery. So I had 3 full days of appointments with different doctors, my surgeons, um, the how is it called? The area which I'll be in the hospital, and the different, yeah, nurses that will take care of me. Um, so this is how it looks like. This has been my whole schedule this week. A lot to do. I met the anesthesiologist. Do you say it like that in English? By the way, I'm sorry for if I say anything bad in English. It's not my mother tongue, but I try as good as I can. Yeah, my anesthesiologist, he told me that they're gonna put in a tube through my nose down to almost the lungs, because you cannot get anesthesia normal way, of course. They also wanted to know if I have any allergies, if I um, am on any pills or so, and this is just um, to make the best treatment for me during my surgery. And also, I have met a lot of photographers. They made 3D photos and stuff, which was pretty cool. It's a new technique. So they have 7 cameras in different angles, and they take the photos at the exact same time. And then you show up on the computer screen as a green Hulk after first, and then after the colors will come, and then you can rotate your head with the mouse of the computer, so you can see every sort of angle you want to see. that was pretty cool. They also did a lot of casts, X-rays. We have two different X-ray machine. So they basically put in something in your ears. I don't know, so you can stand still, and then they just like boop 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 boop. You really feel like a Martian or something. Uh, in an episode of Star Trek. And then with the casts, they did on Tuesday test surgery. So they have the whole head or most parts of the head, and they do the surgery as they will do it on Monday. So they can see that everything will go um, as they plan, and the results more or less. And I got a positive answer from my orthodontist that it looked fine, and they got a plastic, I don't know, bite or something that they're gonna use on the in my surgery on Monday. So that's why they have to do the test surgery, and also to be sure that they know what they're doing. Yeah, I've talked about the surgery. Yeah, more about the surgery. Like I said, they're gonna operate my both jaws, move this 3 millimeters out, 3 millimeters back. My surgeon also said that if when I will wake up, that I will, well, that I don't get surprised that like a red spot will be here in my forehead, and this is because they will put a small nail here, so they can measure the symmetry from this nail. I don't know. It sounded really funny. So as long as they don't put any painting on the nail, I'll be fine. Or don't post anything on the internet while I'm asleep. Yeah, anesthesia. Yeah, they're also gonna put in a catheter. I think you pronounce it like that. Catheter in the urine pipe tube, and this is to release the pressure during the surgery if they have to, if it's full. um, yeah, that was about it. Also, I have gotten a little bit of instructions before my surgery. Of course, I have bought a mixer and everything like that, so I can be on liquids for 2 months. That's going to be really difficult because I love food. I love food from the bottom of my heart. I eat a lot, even if it doesn't show, but I do because I work out a lot. I play tennis. I'm an athlete, but just because I love food also. So that's going to be tough, but I'm prepared. If you could do it, I can do it. And also, I have to buy straws and all those kind of things, practical things. I don't know if you did this in your countries, but I have to have a sterile shower. I bought 2 or 3 packages in the pharmacy, and I have to shower 3 times, but the double, like twice, with the soap and everything, with a special kind of, I don't know, with a special kind of glove or something, head, the whole body to be as germ free as possible. And I also got 8 anti-swelling pills that I have to take the night before the surgery. And what else? I don't think I have forgotten anything. For now, I showed you my jaws. Yeah, the thing is that I also, yesterday, I got my orthodontist putting these nails here. They're a little bit flexible, but they shouldn't be. Anyways, after surgery, they will put in rubber gums. so the jaws don't move, that they grow and recover as they should. So I got them both up here and down. Yeah, I think I said most of the things that I wanted to say from my list. Yeah, so of course I'm a little bit nervous. I'm sorry for taking so much of your time right now. I see like 15 minutes and yeah. I would love to hear your thoughts if you have any questions, anything like that. Just ask me. I'm a little bit nervous, as I said. 2 more days until the surgery. I can use a lot of positive words. Yeah, I will try to post a video the night before so you can see how nervous I am, and to answer your questions if you have any. And now I'm gonna actually go out, see my friends, enjoy the sun while it's here in Sweden. Not that often, but when it's here, we take every seconds into count and do fun things. So I wish you all a really nice day, and talk to you soon. And thank you for watching, and thank you for posting your videos because they have helped me so much. Thank you. Bye.